Hey everyone! Today we're talking about one of the most common questions in IVF. Does the choice of clinic really affect embryo quality? And the short answer is yes. Not because clinics change your biology, but because they influence everything that happens around it. Every IVF journey begins with the foundation you bring in: your age, your ovarian reserve, and your biology. These are universal factors. A 32-year-old and a 42-year-old will not respond the same way to stimulation, no matter which clinic they choose. The same applies to sperm quality and the genetic makeup of both partners. These are biological starting points that no clinic can change. They set the baseline before the lab even touches an egg or sperm cell. But once the eggs reach the lab, the difference between clinics becomes very real. The embryology lab is the true engine room of IVF. A stable, well-controlled environment, the right temperature, the right oxygen and CO2 levels, clean air with minimal toxins, directly affects how embryos grow. Even tiny variations can impact whether a fertilized egg reaches the blastocyst stage or stalls along the way. And just as important as the equipment is the team that handles your embryos. Experienced embryologists who aren't overloaded with too many cycles can work precisely, consistently, and calmly. When staff are stretched thin, embryos spend more time outside the incubator, procedures get rushed, and the risk of small errors increases. Skill and workload, not just machinery, are huge factors. Another key difference between clinics is how they design stimulation protocols. Some clinics individualize every step based on age, AMH, follicle count, and previous response. Others use one-size-fits-all protocols that may produce too many eggs, too few eggs, or eggs that aren't optimally mature. And because egg quality determines embryo quality, a poorly chosen protocol can lead to weaker embryos long before they even reach the laboratory. So how can you tell whether a clinic is truly high quality? One helpful indicator is lab performance data. You can ask clinics about their blastocyst conversion rates by age group and how many embryos survive freezing and thawing. These numbers tell you how well embryos develop in their lab. You can also ask about people and protocols. Is the lab accredited? How many cycles does each embryologist handle? Is your stimulation plan individualized or standard for everyone? And finally, don't get distracted by perfect embryo grades. An embryo labeled 5AA in one clinic might be graded differently in another because grading is partly subjective. The real measure is how consistently embryos grow, survive, and implant, not the letters and numbers on the screen. Choosing an IVF clinic isn't about chasing the fanciest technology or the prettiest pictures. It's about understanding how biology, lab conditions, team expertise, and individualized care all work together. When those pieces align, embryo quality and your chances of success improve in a very real way. For more information, visit ivfforme.com.